Hello, social workers, mental health professionals, and change agents. Welcome to another episode of season 7 of the Social Work Rants podcast. I'm your host, Bass Moreno. Saludos a todos. Greetings, everybody. Thank you for tuning in, tapping in wherever you are watching or listening to this podcast episode. I appreciate the level of support. Gracias a todos otra vez por su apoyo. Wherever you are tapping in, watching this podcast, or listening to this podcast, however you get your content, I appreciate a lot of support. Make sure you continue to follow, share, rate the podcast, leave feedback on all social media platforms, and however you listen or watch the content. Follow the podcast on all social media platforms on Instagram, Facebook, aka Meta, and Twitter. Instagram at the Social Work Careers Podcast. That's all one word. I'm not afraid of Elon yet. So on Twitter at Social Work Rants and Facebook, aka Meta, type in the Social Work Rants Podcast. Hit that like button, hit that red subscribe button on the YouTube. Those are the social media the podcast is on. So I'm not on Threads and not on the Spill. Like I'm not on those. Not anticipating to be on those anytime soon. So those are the main platforms to follow. So again, kudos to everybody to that's been listening to the podcast and rocking the podcast with the podcast. So uh, before I get started, disclaimer, since I always forget to do it on video, this episode is for educational and entertainment purposes only, is not a substitute for therapy. If you need assistance, please call 911 or call your therapist if you have one, call a psychiatrist if you have one, or go to your local emergency room for any sort of crisis, or call 988 for any sort of crisis. It's okay not to be okay. For all my listeners and viewers out of the country, whatever is your emergency contact information, emergency number, please use that and get the help that you need. Um, as my eyes are like watery from like the light being bright and still literally just had dinner as before I recorded this episode. So my guest at this time, we met at the great uh, social work conference for social work on HIV and AIDS in Washington, D.C. back. That was in May, right? Because time goes so fast.
Yeah, it was right before Memorial Day weekend.
Yes. So, Amy, how are you doing? How you been?
I'm great. I'm great. It's good to be here. Thanks for asking me to be on.
No, no.
I'm really excited. I feel like besides the social work conference, which I attend every year, I'm not always as, connected to the field as I would like to be. So I'm really, really happy to be here, talking with you and talking about social work.
Yeah, absolutely. And the power of number one, shooting your shot and just going up to people, just and talking to people and actually, networking and connecting, the importance of that in our field, especially nowadays, not only just with social media, but just as we get back post COVID into having conferences in person and just overall meeting people in person, or if you meet somebody through social media and actually meet them in person, kind of having those connections and those important to kind of have we connected at the conference. Amy did a great presentation. We're going to talk about policy and relates to HIV, AIDS, and social work, and just things that the Biden administration are doing and trying to do for the population. Just talk a little bit about policy work, because a lot of us are burnt out from doing clinical work, and like what else can we do in the field and policy. I've been seeing it's getting a little bit of some steam. I know a couple of social workers doing great work in terms of policy, like in New York State and in California. So, yeah, so let's get into it. Amy, let people know who you are and what you do in your role currently.
Sure. So as mentioned, I'm Amy Palilones. I am the Deputy Director of the Office of HIV/AIDS Housing at the U.S. Department of Housing and Urban Development, or HUD. And the Office of HIV/AIDS Housing manages the Housing Opportunities for Persons with AIDS, or HOPWA program, which is the only federal program dedicated to addressing the housing needs of people living with HIV and their families. And so I am really responsible for a team of leading a team of people that are focused on HOPWA program policy and operations. So if there are new regulations that need to be put in place, or there's new guidance that needs to be developed, or there's technical assistance support and education for our grantees. I'm really the lead for all of that work within the Office of HIV/AIDS Housing.
That's awesome. And now, are you also partly responsible for giving like contracts to nonprofit agencies that provide housing for?
Yeah, so my office, the Office of HIV/AIDS Housing, we give out the HOPWA grants.
Okay.
And so there are local HOPWA programs in all 50 states, DC, Puerto Rico, and the US Virgin Islands. And those grants are given out in two different ways. So the largest amount of funding each year is put into formula grants, and they go out to cities and states based on HIV cases, poverty rates, and housing costs. And so basically those cities and states are pass-throughs. They receive that grant from HUD, and then they turn around and contract that out with nonprofits, mostly, to actually provide that housing assistance and support through supportive services. And then there are some grants that my office gives out directly to nonprofits, and those are called competitive grants. And states and cities are eligible to apply for that funding, but mostly we fund nonprofits directly using those competitive funds. And basically in order to receive that competitive funding, the entity would apply to a notice of funding opportunity that my office puts out in order to access those grant funds.
Yeah, excuse me. I'm familiar with HOPWA because one of the agencies I used to work with received funding through the HOPWA program. So I got my first taste into learning about the grant and what it does and how it funds the program. So for those MSW students or new into the field, definitely follow the money in terms of like what your agencies, how they get funding, and even ask those type of questions during your interview process when you're trying to get a job, like how you guys are funding, because like you just said, the keyword competitive, like people, these agencies are fighting for the same amount of money as other agencies are, and it's very competitive. And I've had several episodes on housing because it's such a huge topic and it's an important conversation to have because housing is expensive in America. And I say in America because all over there's a huge housing crisis going on. Not just related to social work, but for us social workers to really be paying attention to it. People are getting, have Section 8 vouchers, people are getting other sort of vouchers, and people are not taking them. So people are having issues finding housing, and there's just really no such thing kind of as affordable housing in 2023, even though politicians like to use the affordable housing, but there's really no such thing. So it's really interesting and fascinating, kind of what you do. And so how do you get into the work that you're doing? Is not common, kind of like social work grad schools want to like focus on clinical work and do the private practice, or like kind of do other things, but like how'd you get into policy and the role that you're at HUD, which is a major federal agency.
Sure. Yeah, no, that's a great question. And this is I've been in the Office of HIV/AIDS housing for 14 years, and this was I really landed in OHH right after I got my MSW. But I'll backtrack a little bit. I got my BSW, and when I was in social work school and undergrad, there were a few, one or two courses that were specifically on sort of policy and really like a history of the social safety net and federal programs. And I just thought they were my favorite classes. They were just so interesting to me, and made it really clear that, in a lot of ways, the social safety net is broken. And there are a lot of ways that federal, social service programs could be improved upon. And so it just sort of got me really interested in federal policy and that federal policy work and how laws can be implemented in a way that really is the most impactful to people. And so when I was applying for graduate schools, I knew I wanted to do policy. So I was really just looking at schools that had sort of a policy track. And so I'm from New Jersey originally. I did my BSW at Rutgers. And so I was sort of looking at schools in the New Jersey, New York, Philadelphia area. And so I landed on, I applied to Columbia University because they had, a policy track with like a really good reputation. And a lot of other schools in the area really are just clinically focused, as you said. And Columbia had this strong policy track that I was interested in. But I think that so I applied to Columbia and I got in. And I think I mentioned this at the social work conference when somebody in the audience was asking a question about policy. But I actually sort of got discouraged from doing the policy specific track at Columbia because some of the admissions office folks basically said you should only be doing the policy track if you have completed advanced math. So like they were saying, if you completed calculus or math at that level, which I had not at that time. And I know there was a pretty big economics focus, I guess, or there's an economics component of their policy track. But I mean, really, I think in the work that I do, statistics and understanding statistics is probably more important than having taken advanced math. I know that now, 14 years into it. But at the time I got discouraged. And so I basically ended up not doing that policy track route. And there was another sort of concentration area that they had called social enterprise administration, which is basically folks that were interested in like nonprofit administration, which I do think is very translatable to the public sector job that I ended up having. But yeah, I got completely discouraged from actually focusing on policy in social work school. And I did the social enterprise administration route, which was great, and learned a lot about evaluation and sort of administering grants almost, and budgeting and things like that. So it was still a very macro focused track, but it wasn't that specific policy lens. And so it was advertised at, so how I got to HUD, I saw an advertisement, in one of the common areas at the school for a program called the Presidential Management Fellows Program. And basically what that is sort of a 2-year program for recent graduates with graduate degrees to sort of fast track them into the government and then sort of like more leadership roles. And so I applied for that process. There was sort of a 2 or 3 step process where the dean of the school sort of solicited applications from students and then recommended students for the program based on their applications. And then you had to take this test, which was sort of like a personality type test, a culture test to fit into government work. And so I got through and I was accepted into the Presidential Management Fellows program. And my first job in that program, I landed in the Office of HIV/AIDS Housing, where I still am, and I have been there ever since. And I was really I actually at the time didn't know that much about HIV. So I wouldn't say I was interested in HIV specifically, but I was definitely interested in housing and housing policy, and how those policies can impact people's lives.
Right.
And so I was really drawn to the mission of the Office of HIV/AIDS Housing, and just really the important housing related work that it does. And so it grew from just an interest into really a solid passion of mine, is housing and health and how they intersect.
No, I love it, and it's so important. It's super relevant, especially currently, and is always going to be relevant. Not just in social work, but just in general. No, you need shelter. That's part of our basics in terms of just living as humans, uh, and it's important to stress now. You might be evicted or be forced out, or fire happens, or floods. We got hurricanes, tornadoes. Is like anything can happen in terms of housing or lack thereof. So it's always going to be relevant in our society, in our world, and how it relates to social work. We got clients who we see that they're struggling paying rent, paying mortgage, or looking, like you mentioned, looking for housing. So it's I like that backstory. Very interested how you got into the role that you're doing. How's it changed? Because you've been there 14 years. Obviously, we got that's under several different administrations. Has your role kind of changed depending who's in office?
I wouldn't say that my role has changed depending on who's in office, but I would say that the priorities of HUD definitely change depending on who is in office. I will say that HOPWA is a relatively small program. Something amazing that has happened over the 14 years that I've been in the office is that the annual budget for HOPWA has grown substantially. So when I first started in the office in 2009, every year Congress would give the program about 300 million, 330 million. And over the last several years, the appropriations and the budget for the program have continued to grow. And now we are at around 500 million per year, which is really amazing. And those increases actually have kind of happened regardless of who is in office, which I find, to be amazing. But I really think that it's sort of a result of there are some really fierce HIV housing advocates that are on the Hill all the time and really demonstrating the need for housing for people with HIV and really demonstrating that need, demonstrating the connection between safe, stable housing and positive health outcomes for people with HIV, and they have just been so effective at that work. And I will also say, I think my office does a great job of really, one of our main roles is elevating the importance of housing and ending the HIV epidemic, both within HUD, so that HUD's officials know about HOPWA, know about how important housing is for people with HIV, and set their priorities for that, and then also outside of HUD and communicating with our our federal partners that are working on health related initiatives, sort of making the case for that connection between housing and health, and also making that connection to the Hill when we're asked to justify the HOPWA program's budget. So I will say, regardless of who's in office, I have seen steady increases to HOPWA program funding, which has been really amazing. And also in that time, when I first started working in the office, there were probably about 10 people in the office. Then just with people leaving, maybe the office not being prioritized as much at different points in time, the office staff dwindled down to 3 people. And now over the last few years, with a really strong commitment by HUD leadership to staff up, the office has risen back up to about 15, 16 people, which is really, really amazing, because doing this work with only 3 people, we were just treading water, and we weren't actually being, able to have any sort of foresight or really effectively plan for anything. We were just trying to do the basic functions and get what we could done. But it was really hard. And I know a lot of people out there feel that way in their organizations as well, that they're they only have enough staff to tread water, and it's really not it's not a good feeling for morale, and it's just not effective either. So
for those who don't know what is HUD, you give an explanation of what exactly is HUD.
Sure, yeah. So HUD's the Department of Housing and Urban Development. It is a cabinet level federal agency that is really responsible for meeting the nation's housing needs through a variety of ways. HUD is a fairly large organization. There are parts of HUD that I don't know that much about, just because I have my little lane of HIV/AIDS housing. But HUD backs mortgages for people, the FHA loans. HUD funds the public and Indian housing, so which is a very large arm of HUD, which funds public housing, as well as Section 8 vouchers, which people may have heard of. HUD funds an enormous amount of affordable housing development. So developing affordable housing projects in communities. And then the part of HUD that I work in is the Office of Community Planning and Development. And within that office, it's the Office of Special Needs Programs. So, which is the HOPWA program, as well as HUD's homeless programs. So the Homeless Continuum of Care program, ESG grants, and all the HUD programs focused on ending homelessness. So, all of it is sort of housing and community development focused, but there are just a lot of different programs and ways that HUD supports that housing and community and economic development.
What as you probably seen, and you probably deal with it day in, day out, or hear stuff. I'm sure some of it is like hearsay, whatever, but we got I'm originally from New York, and the housing has been crisis has been years has been I'm kind of now living in Delaware, kind of seeing it now. Like definitely rents has gone up substantially, and like even like native Delawareans that I talk to, be like, I can't believe like housing is like $1,400 for one bedroom, and like that's not quote unquote normal like in Delaware. Especially since housing has increased so much since like 2019 and going into 2020 now. Years later, it's just going to continue to go up. You mentioned HUD with like the housing developers. I've seen that in the streets, in New York, all these different housing developments that are going up, affordable housing units going up, like shelters are kind of out of control. How that relates to social work. Basically, like what are you seeing in terms of what you guys are trying to do? No, no, I know you work with the HIV population, and like one of talking to different people at the conference, like a lot of social workers work in housing programs, specifically for people living with HIV. That's something that Delaware doesn't have, which kind of frustrates me. The work that I'm trying to do with my clients day in day out. That I got literally have clients sleeping in their cars, and because the housing programs that we do have do not offer housing. They offer case management and do a great job, but like, and I even had those conversations with staff there, like, why can't your agency like apply for a grant and try to get some land and develop a housing program for your clients, and you basically and just hire more case managers to do the case management piece from the housing program. So it's like, what do you say to all that? What I'm trying to say.
Yeah, so I guess sort of like what are we focusing on, or what's
Yeah.
our priorities, or what are we, well, I guess I'll start with what we're hearing, which is a lot of, and seeing, which is exactly all of what you were saying. I mean, there's a housing crisis almost everywhere. And there's just a lack of affordable housing. We hear a lot about, even if somebody, a component of our program operates very similarly to Section 8. So a person with HIV gets a voucher and goes out into the private rental market and secures a unit that way. We hear and see all the time of landlords refusing to accept vouchers, or just not being able to find a unit that fits within the rental amount approved for that voucher because rents are just so high, or people being sort of just limited in the areas where they can use that voucher, and maybe they're not areas of high opportunity, or they're not close to their medical care or other services, or close to employment opportunities. We hear all the time about barriers that local housing programs put in place, regarding who they'll serve. So for example, there are definitely some HUD programs that have limitations on who they can serve based on criminal history, and things like that. The HOPWA program is not one of them. There's only two eligibility criteria for the HOPWA program. It's low income and HIV positive, but there are a lot of local programs out there that either have the misconception that people with certain criminal histories, for example, sex offenders, aren't allowed to receive HOPWA assistance, which is a misconception. There is no bar on that from HOPWA assistance, or even just thinking if anyone has any sort of criminal record or criminal history, that they aren't able to access HOPWA services, which is not true from the federal policy perspective. So we've just been hearing a lot about just barriers that local programs put in place that make it really hard for folks that are already disenfranchised to sort of rebuild their lives and and access housing. And so a lot of the work that my office has been doing recently is sort of trying to break down those barriers through education where we can to HOPWA funded organizations. We actually just had this really great 3-part webinar series called Client-Centered Clients, something like providing HOPWA client-centered services or something like that. And it really focused on housing first and promoting the idea of housing first, really getting people into housing and then providing the support needed to address, all the other issues that that client might be facing, such as substance misuse, access to needed mental health support, things like that. It's not making people jump through a whole bunch of hoops and prove that they're ready for housing before placing them in that housing. It's recognizing that if somebody doesn't have safe, stable housing, it's really hard or impossible to address all of those other issues that person might be facing. So it's getting them into that housing first and then addressing those issues and doing that in a client-centered and very low barrier as much as possible way. And when screening clients, really doing that screening to understand what's going on in their lives instead of using that screening to sort of bar them from housing or not or screen them out. So it's really screening people in instead of screening people out. So that's some work that my office has been doing recently, is trying to educate the organizations that receive HOPWA funding on how they can make changes to their programs and service delivery models that are more inclusive to people and, are consistent with the law and regulations, but really are screening people into the program and screening people out of the program. And we totally recognize that this is really, it's difficult. It's difficult work, but if you make it so that, only certain people that you think will be successful or easy to serve access your housing programs, then you're really not meeting the need, and you're really not getting to the people that need assistance the most.
No, I absolutely. I totally get that. Now at the conference, well, before I ask this question, how do you, especially from a policy perspective, got picked to present at the conference?
Oh, so that's a good question. So I'm on the board of the Professional Association of Social Workers and HIV. And so I'm pretty actively involved in that organization. That's that organization that puts on the annual National Conference on Social Work and HIV. And so I've been going for the last maybe 6-7 years. And I try to present every single year. So we go and we usually are doing some sort of HOPWA education there. We do like HOPWA 101s or HOPWA program updates because a lot of HOPWA grantees and HOPWA funded organizations attend that event. So we use it as a way to engage with the HOPWA funded organizations and provide training and hear about the things that they're seeing and issues they're facing in their community. So I've presented a lot, and they were putting together a federal panel and wanted to feature people from federal agencies that are working on HIV health and prevention and housing related work. And so I'm the only MSW in my office, I think. And so because of that, I think it made sense to, and because I've been such a presence at the conference, I think for the last couple of years, they invited me to speak on that panel and just give, it was really advocacy focused, which was great, but the focus of the panel was on sort of how can social workers get involved in advocacy, and then also sort of reflecting on since the beginning of the epidemic, what have been some sort of the wins and the policy changes, or what has really resulted from advocacy. So sort of where have we been? How can social workers get involved now? And then sort of like what are the main places where people or the main issues social workers can advocate for in the future.
Yeah, I was really impressed that at the conference that they had somebody like yourself who is in the federal government, works in the federal government, talk about HOPWA is such a big, you provide grants that provide jobs for people, social workers, case managers in the community, and to have access to speak to you and provide what exactly you guys are doing and hearing what's exactly is going on in the field. And definitely like the struggles with housing, affordable housing was kind of like across the board. Like talking to different people from, there was a lot of people from Texas there, a lot of people from Indiana was there. And we could flip jobs, agencies, and still be dealing with the same issues. So it was kind of uh, really great that you were able to there and kind of talk to you, which is why landed here talking right now with you. So
yeah, and I love that conference. I look forward to it every single year because it's such a great way to connect with people like yourself, and also just to feel more connected to social work as a profession. I think I said this at the beginning. Obviously, I think that my background as a social worker is so important to the work that I do, but it's not
absolutely.
necessarily a requirement, right? Like, not, as I said, I'm the only MSW in my office. There's a lot of public administration folks. We have a lot of folks with Peace Corps backgrounds and things like that. So it's sort of like it's a job that a diverse range of people can do. But I think that my social work background is so important and really frames how I think about the work that we're doing. But that being said, I don't get to connect with that many social workers in just my day-to-day job at HUD. There are definitely a few, and that I work with in other HUD offices, and that we collaborate together. But sometimes I feel like I'm missing out on that strong connection to the profession. So that's why I love being on the PASWA board, and that's why I love attending the conference, because I get to, as I said, connect with other social workers, hear about what folks on the ground sort of are experiencing, and then sort of think about how, through a policy lens, some more work that can always be done.
Yeah.
More work that can always be done to improve the lives of the folks served by the program, but also make the jobs of the case managers and other folks implementing HOPWA programs, make their lives or make it easier for them to do their jobs.
Yeah, because the work is definitely, it can be hard, especially the jobs that I've had prior to what I'm doing now. That really was like out in the field doing home visits and apartment inspections and kind of like trying to follow like the HUD guidelines on top of like HOPWA, or there's like another grant focused program that relates to HIV as well. Um, at the conference, you mentioned some of the win. No, you mentioned wins, and you mentioned some of the wins that the administration has been doing, and this is not a question about since 2024 is around the corner and the presidency reelection, but seriously, but like just for educational purposes, like what are some of the things that the president has been doing to help people with living with HIV, and I know he's made a strong push on his agenda to try to end the epidemic by 2030, and you know, I always see the commercials for all the different medications that's out there. I don't see. Maybe it's just a Delaware Philly thing because my news feed is from Philly, but I don't see a lot of prep commercials.
Mm.
Um, Even though prep, anybody could be on prep. But everything else that's out currently, I see commercials for. So, what are some of the wins the administration has been doing to help people living with HIV?
Sure, yeah. So the administration has been there's a focus on two different sort of overarching initiatives. There is the Ending the HIV Epidemic initiative, or EHE, which is a targeted, that's really a Department of Health and Human Services initiative. So it's the CDC and HRSA, Ryan White initiative that is sort of infusing resources and money and support to jurisdictions that are hardest hit by the HIV epidemic. That initiative actually started under the Trump administration, but the Biden administration has continued that work and adopted that work and is committed to continuing to build on that on the work being done in those 57 EHE jurisdictions. As I said, HUD is not specifically included in that. So HUD doesn't receive any dedicated funding for EHE like the CDC does, or HRSA's HIV/AIDS Bureau does. Just HUD wasn't included at the very beginning of that initiative, but we have tried to, we're very collaborative with CDC and HRSA, and have in a lot of ways collaborated with the folks implementing that EHE initiative by providing housing related data and information, making sure that the health departments implementing the EHE funding are connected to housing providers, as appropriate, because really, everywhere, whenever there are listening sessions or things come up, there'll be health or even like CDC or Ryan White focused listening sessions. Housing always comes up as, if not the number one, such a big need that communities are facing. And so people are really just hungry for information and resources and ways to connect people to housing. So we have been working to support our federal colleagues in in implementing that EHE initiative as much as we can. The other main federal initiative under the Biden administration is the National HIV/AIDS Strategy. That is broader than the EHE, and that actually includes numerous federal agencies. It's really any federal department or agency that has anything to do with addressing the domestic HIV epidemic is included in that work. And so HUD is one of the members of the Federal Interagency Working Group, that works on sort of developing and implementing the National HIV/AIDS Strategy and sort of developing these action items and goals and strategies to meet to meet the overarching goals of the National HIV/AIDS strategy. And so HUD is a really big part of that. And I will say over the last few years, and with the newest iteration of the National HIV/AIDS strategy that the Biden administration put out, it is obvious that there's a real focus on housing. There has always been a focus, there's always been some sort of focus on housing in the National HIV/AIDS strategy since it first came out in 2010. But this most recent iteration really stresses the importance of housing, not just for people living with HIV, but also housing as prevention, which is not something that has been focused on as much in the past, but the research really shows that safe, stable housing has profound impacts on HIV prevention, as well as on getting people with HIV connected to care. Because if you are stably housed, you're able to get connected to HIV prevention services, you're able to get connected to PrEP, and so there has been just a much bigger focus on that I think is really amazing and beneficial. And my office, the Office of HIV/AIDS Housing, has really been trying for years to elevate housing within the National HIV/AIDS strategy, and I think we've gotten to a point where that has really happened. And the focus of HUD's efforts under the National HIV/AIDS strategy aren't just through the Office of HIV/AIDS Housing. So in the past, it was really just my office doing this work. We're the HIV office. That's who is working on the strategy. But now it has really been recognized that HOP was not enough. There's the HOPWA program resources aren't enough to meet all of the housing needs of people with HIV. And there really needs to be an all of HUD approach. And
absolutely.
And the HUD's homeless programs need to be involved. Public housing needs to be involved, because people with HIV or people vulnerable to HIV are eligible for all of HUD's programs and can benefit from all of HUD's programs, but we're not necessarily reaching everybody that we need to reach. And there needs to be more of an all of HUD approach to do that. And so I think that's been something really exciting that has been sort of evident in this most recent iteration of the National HIV/AIDS strategy. Just sort of really recognizing the importance of housing, and that we can't end the HIV epidemic without ending homelessness and housing instability.
No, absolutely. And that goes to my point to if HUD is focusing on helping you guys with the housing, however that looks like, even if it's, buying out, the land to create the properties for people to live in, or whatever it's going to work, especially states like Delaware to kind of have that initiative to maybe eventually have a housing program, because I definitely seeing a lot of new infections, and young, like in their 20s. Got a immigrant population, like Haitians and Latino Latinx, coming into the country the last, well, at least during COVID, and being like either newly infected or already infected, and coming into the country and seeking care. So it's things are still happening, and is not enough of like the resources. So definitely like to see HUD and just like not all the states kind of like working together and collaborative to try to really, like you said, like without housing, there's nothing can really happen. Like people going to be missing their appointments. I mentioned on past podcast episodes, like, and I put the SOS out to those in clinical work that do the therapy work. Like, you're gonna be missing, clients gonna be missing appointments because the national emergency ended. So people who have Medicaid or losing their Medicaid, people gonna be stressing out about housing and food, and we got a kind of little recession going on, and inflation happening. So there's a lot that's happening that affects us in the field and kind of like really kind of like open their eyes to you're doing a lot of groundwork, case management work, like food stamp applications, how Medicaid applications, housing applications, and a lot of shelter referrals or things of that nature. So it's like I said, housing kind of makes the world world go around. Without the housing, then everything else kind of you know you need. I know there's injections in terms of HIV now, but people still for a lot of people still taking one pill a day. We got old school folks still taking multiple pills a day. So if there's no housing, there's nowhere you could store your medications. Where you're gonna put your medication at? You're gonna be
Right.
unless you're carrying it around in your pockets, and but still, like people need the housing. They need that. It's part of our basic needs that they teach us in grad school.
Right. Yep. Yeah. I mean, if you're stressing about your housing, if you're in an unsafe living situation, if you're experiencing homelessness, it is so difficult to care about, or put any energy into anything else.
Mhm.
Or, really, yeah, as you said, store your medications, or even make it to that doctor's appointment, or really do what you need to do to focus on your health. It makes it really, really hard.
Like you're newly diagnosed and you're about to start medication and you can't because you're stressed about the housing and you got to miss
Mhm.
appointments. So it's a lot that's happening. Now I'm glad to hear like all the work that's doing and like I mentioned to you at the conference, I was 10 minutes. The administration really stress or have that messaging out there more in terms of the work that you got that all of you guys are doing and are trying to do, and maybe we'll hear that because the election is coming up. But people need to know about it. Us who work in the field day in day out need to hear like stuff is happening. There's potential for like possible like expansions or possible who knows maybe some of that might lead to more grant money and or expansion for programs which will lead to future jobs for case managers and social workers to get into the field who may not need to have a license to get a job. So, the future is bright, I would say.
I agree. And I also agree. I think that we could do a better job of advertising what we're doing or talking about what we're doing. I feel like at least in my office, we're so heads down focused on just like do our grantees and the organizations receiving HOPWA funding, do they know the requirements? Do they know do they know some of the best practices around housing? And we're really just communicating and putting all of our resources into that. But I do think that we could do a better job of more broadly educating people on sort of and not even just for HIV, but
Mm,
educating people on what's out there,
mm,
what the priorities are around housing, and sort of how people can get people doing the work, or even people that can benefit from the programs can get connected,
mm.
and sort of understand what resources are out there.
No, yeah, absolutely. There's definitely a lack of kind of like information in terms of like what resources out there because there are resources out there. Is like where do you go to try to get the resources and what's out there and people moving in different states and or adjusting and not know where to go or who to talk to. So yeah, all that.
Yeah, and
It,
I will say it breaks our heart all the time in my office is that a lot of the staff's time is spent connecting people to local housing organizations.
mm,
So people have such a hard time navigating the resources in their community,
mm,
which is where they would go to access those resources, that they're calling us at the federal level and looking for housing applications or looking for housing assistance. And we can point people in the right direction, like say, hey, we know this organization gets HOPWA funding,
mm,
but we're not the people directly providing the housing. But it's there's so many challenges with navigating the available resources on the local level that
mm.
people just end up calling us, which I'm glad they have us as a resource, but it's definitely not the most direct direct line to
Right.
assistance and information.
No, yeah, it's and it's important, and it's a work in progress. And like I said, it can be done from the federal level, but definitely like the states and local government, like you said, like we are getting you are getting the funds. What are you doing with the funds? And like, and I know
Mhm.
you guys do audits and stuff like that, and like I've been a part of those chart audits at work, and so it's and so it does happen, and there is accountability with that, but it's important for people who are struggling, they need help, where they need to go, where can
Mhm.
they go to get the
Right.
services that they need. How can people get in contact with you or with the office?
Oh, yeah, no, that is a great question. I don't know if there's an ability to provide like a link or anything
Yeah, if you
on
could
the
send it to me, I could put it.
Okay, great. So we have a HOPWA page on HUD.gov, and that page has a listing of all the staff contacts for the Office of HIV/AIDS Housing. And the way we sort of divide things up is we have office, we call them desk officers, and they're basically responsible for specific states. So if you have a HOPWA specific question or want more information on HOPWA, or even a HOPWA assisted household, and you're having some sort of issue with your assistant, you can give us a call, and those contacts are on HUD.gov, as well as my contact information. And so I will definitely make sure that I send you that link.
All right, awesome. Thank you so much for your time, taking out of your busy schedule to come on and connecting with you again, and coming on the podcast.
Thank you very much. It was great talking to you.